Radio MD. RadioMD.com. This is Healthy Children, brought to you by the American Academy of Pediatrics on RadioMD.com. Here's Melanie Cole, MS.
You are likely very much aware of the ongoing attention focused on the Ebola virus disease outbreak in some West African countries, which continues to escalate, but we are here to put some of your concerns and fears to rest. My guest is Dr. Yvonne Maldonado. She's the chief in the Division of Pediatric Infectious Diseases at Stanford University School of Medicine. Welcome to the show, Dr. Maldonado. So tell us about the virus. What is it? How does it spread? And why is it so hard to treat?
Yes, Ebola virus is actually a fairly rare virus, and it's only really found, in the majority of the cases are found in Africa. The first viruses were identified in 1976 in Central Africa, and since that time there have been a number of limited outbreaks in Africa. What's interesting and unique about this particular outbreak is that it has occurred in an area that is more populated, and therefore the transmission of the virus has been more difficult to prevent.
So why should people, as it's spreading and it's difficult to treat, but you've stated that it's in a populated area, so it's a little bit harder to prevent because it is a contagious disease. Should people in the United States be concerned about Ebola?
Again, we should always be on alert for viruses and other organisms that can enter the country and cause disease, but I would say that this is a very low-risk situation for the United States. To date, we have never had this type of Ebola virus infection in the United States that has started in the U.S. As you know, we have the two patients who were transferred to the U.S., these two Americans, for treatment. This virus is actually, contrary to what you see in the pictures, it's in the television, it's not really easy to transmit, but because of the excessive precautions, people are wearing what we call PPE, or personal protective equipment, to prevent transmission. And that transmission occurs from bodily fluids of an infected person. And as far as we know to date, we have never seen transmission occur from an infected person who has not had symptoms. So all of the infections have occurred from people who have symptoms of the disease and transmit from infected bodily fluids. And these are almost all bodily fluids that you can think of: blood, sweat, saliva, etc. So the key issue here is if you're in an area where there is Ebola, and at this time it's really limited to 4 countries in Western Africa, which are Guinea, Sierra Leone, Liberia, and Nigeria, and you're in contact with somebody with symptoms who has Ebola, then those are people from which you should be very careful not to have contact.
Dr. Maldonado, is the United States, you mentioned the two Americans, are they letting people in with this virus to treat them here? Because I think the public gets scared that now people are going to start emigrating from West Africa and be bringing the virus here on planes.
Right, and that's a legitimate question. But the CDC, the Center for Disease Control and Prevention in Atlanta, which is our public health service arm of the federal government, has set up screening opportunities in these countries where we know the viruses exist now to try to prevent people from traveling who are ill with this virus. We are also monitoring people for symptoms at all major hospitals around the country to be sure that anybody who has symptoms that are consistent with Ebola virus are identified as being potentially at risk for the virus, basically because of travel to one of those 4 countries or being in contact with somebody who has traveled to one of those 4 countries.
Are there travel restrictions in place right now?
Well, there is a CDC travel alert, and I actually just earlier today, I checked this regularly, the State Department website as well to look for travel restrictions. And there are no formal restrictions, but there is a highly recommended advice from the government to not travel for non-essential reasons to those 4 countries. The 3 countries, not necessarily Nigeria, but the other 3 where the epidemic appears to have hit the hardest.
If someone does have to travel, are there some precautions that you want to make sure that they take?
Well, I think that if someone is going to travel into those areas, they first of all would want to be very careful to stay away from some of the areas where we know that the epicenters of the epidemic are occurring. And in fact, the World Health Organization is working with the 3 countries that have been hit the hardest, that is Guinea, Sierra Leone, and Liberia, to quarantine areas where the epidemic has really been not well controlled. So unless there is a specific reason, for example, humanitarian aid or health workers who are there to help, people should stay out of those quarantined areas. In addition, I think, an abundance of precaution, someone might want to be prepared to of course, inform the State Department that they're traveling to those areas, to those countries, just so that, and that should be a good idea anyway when you're traveling outside the U.S., is to register with the State Department. It's on the website, and it's very easy to do.
Dr. Maldonado, what concerns have you been hearing? What have people been asking you as the Chief of Pediatric Infectious Diseases? And can this happen in the United States? Because I think that's what everybody's worried about, is can this happen and spread so rapidly? Can it happen? And what have you been hearing from people? What are they asking you?
So mostly what we've been hearing, and we've been very, I believe that we're well prepared at this point. What we hear is, how are we going to prevent cases from spreading in our own institution here and in our community, given that somebody from one of these areas might show up here. We don't know. And just so you know, the symptoms of Ebola are very nonspecific. They are basically things like fever greater than 101.5, severe headache, muscle pain, weakness, diarrhea, vomiting, and abdominal pain, and lack of appetite. So those are pretty nonspecific symptoms, and they generally occur between 2 to 21 days after exposure to the virus, although usually it's 8 to 10 days after exposure. So if you have people who have those symptoms, and those are pretty common, we want to be sure that the first question we ask people when they come in with any of those symptoms is, have you been to one of those 4 countries or to West Africa in general, or have you been exposed to somebody who has been to West Africa? And the key issue here is within the last 21 days. Because if you were exposed to somebody who traveled, say, a month or 2 months ago or a year ago, that's outside of what we call the incubation period, or the time from exposure to development of symptoms. So that's really been the biggest question for us here locally, is, are we taking precautions to prevent somebody with Ebola virus infection from coming into our facilities and not being properly isolated so that that person cannot spread the virus to other people? And we have a protocol in place at our hospitals here to screen all patients and visitors for these kinds of symptoms and for risk of exposure to the areas of the world that have Ebola. So yes, and it is, and again, the reason this outbreak has probably gotten to be so big, it is the largest epidemic of Ebola we've ever seen since the virus discovery in 1976, is because all of the other epidemics occurred in very rural areas where there was very little a likelihood of transmission into major city centers. And what happened here most likely was the virus occurred probably in a village that was close to the borders of the 3 countries.
And I'm sorry, Dr. Maldonado, we are out of time. You're listening to Radio MD. Stay well.